The world around us is hostile to the Word of God and to biblical values, but we are called to be salt and light, to stand for truth in a decaying culture. We are not called to run from the fire, but be willing to step into the fire. God has placed you at this time in history on purpose and for a purpose. Join us as we get better equipped to address civics and culture from a biblical worldview. Welcome to Into the Fire, powered by Dream City Church. Let's welcome our hosts, Debi and Sam.
Today's topic is pro-life is pro-women. And we have with us Beth Boyer, who's a nurse at Choices Pregnancy Center. Yes. Thank you for being here with us today.
Thank you for having me. I'm happy to be here.
Yeah, so before we get started, just tell us a little bit about yourself, where you're from, family, whatever you want to share with us on a personal note.
Sure. So I was born and raised in Arizona, so I'm one of the rare few being too. Like a native, and so is my husband. So it's fun awesome. to tell people I'm born and raised here. I stayed here for college, went to Grand Canyon University, and graduated in 2011 with my nursing degree. And then shortly after that, did some adult medical surgical nursing at Banner Good Samaritan, which is now Banner University, did pediatrics at Banner Thunderbird, dabbled in hospice nursing for a little bit, and then found my way over to Choices in March of 2022. So about a little over 3 years now, which I never thought I would be doing ultrasounds like ever. So I had no prior training, but thankfully with Choices, we want to provide excellent care. So they trained us very excellently to do the best that we can do as ultrasound nurses. So so that's a little bit about myself. Yeah,
that's exciting.
That's so great. Can you explain to us the difference between an ectopic pregnancy and a miscarriage?
Yes, no, that's a great question, because I think they kind of get the waters get a little bit muddied with that. So with an ectopic pregnancy, a baby is growing somewhere outside of the uterus. So within the uterus or the endometrium, that is where the baby should be implanted. The embryo should implant so the baby can grow. However, for whatever reason, it could be there's maybe scar tissue in the fallopian tubes, things like that, or for whatever other reason. As the embryo is traveling to the uterus, sometimes it may get stuck. Sometimes there's ovarian ectopics, but the most common ones are fallopian tube or tubal pregnancy ectopics. So that is what's happening, is the baby's growing somewhere outside of the uterus. So with a miscarriage, though, is with the miscarriage, we're able to see, in certain circumstances, the baby is within the uterus, but the baby may not have a heartbeat at all. Or maybe the woman says, hey, I am so many weeks along, and then we go and look, and things just don't look right. Sometimes the gestational sac within the uterus is nice and smooth, and then other times when we're considering maybe there's a miscarriage going on, sometimes it looks jagged. The baby doesn't even really look, like a baby at that point, and it's trying to reabsorb into, into the woman's body at that point, and just that's the main difference between those two things, and I think that's good to clear that up for sure.
Yeah, and just kind of as a follow-up too, because there's a lot of misconception, and I think some of it's deliberate on the part of people who are trying to change our laws, but care for either one of those things are not considered an abortion, right?
No.
So it's not considered an abortion if you have an ectopic pregnancy taken care of.
No.
And it's not considered an abortion if there's a miscarriage and you need to have some care related to that.
Exactly. Yeah. So at that point, when there is a miscarriage, that's miscarriage care.
Right.
So with abortion, that is the intentional, ending of the life of the baby. Whereas with the miscarriage, that it happens for whatever reason, and that is a different set of care. It's not miscarriage care is not abortion,
right? And so places like this is one of the things that I hear a lot, and that so Choices Pregnancy Center, which I'm actually on the board of Choices, which I love doing that as well. And Choices Pregnancy Centers offers a wide variety of services.
Yes.
We do not provide abortions or refer for abortions, but we do provide referrals for women who are having an ectopic pregnancy or having a miscarriage to go get care for those. So those things don't conflict, and there's no pro-life law in the country that should prevent any of that from taking place, any of that kind of care.
No, not at all. And I think that's a good thing to bring up, because I think with everything, just with the climate surrounding this in the country, maybe even in our state, and I know in other states, it was like, oh, well, if these laws pass and we can't provide miscarriage care, we can't provide ectopic pregnancy care, and that's simply not true. Like those things, like that stays the same, because an ectopic pregnancy is an emergency. And we have in our clinic, in the span of Glendale, Phoenix, and Mesa, we have seen ectopics, whether they were a couple live ectopics where we're able to see the baby somewhere outside of the uterus with a heartbeat, or we had suspicion that there was an ectopic pregnancy. And obviously as nurses, we can't diagnose that. So you're right, we do refer them out to vetted providers that will be able to do further testing, because you can't, the really surefire way to be diagnosing an ectopic is an ultrasound, but they also can check blood HCG levels too, to see if they're rising or falling, to see if there's ectopic or miscarriage happening, or she's just very early. But yes, we want to make sure that she does get care, because it's an emergency, and we have protocol that we follow to make sure she gets, we're not just like, hey, this is what we're seeing, like you're kind of on your own, figure it out. We have those things in place so she can get care. To
protect the women.
Yes.
Because both of them can be dangerous. If you have a miscarriage that doesn't fully complete, and there's things remain in the uterus, or if there's an ectopic pregnancy that isn't diagnosed, both of those can be life-threatening.
Absolutely.
Right?
Yeah. With the ectopic pregnancy, there's the biggest concern is hemorrhaging internally, like if that ruptures wherever the baby is growing. If that ruptures like that, it's such a vascular area that she could bleed out. And then, of course, you're absolutely right with the miscarriage. If it's incomplete, if it's not, if all of, with the baby and the rest of the contents of the pregnancy have not come out, then there's a great risk of infection. So, so those are very much two separate ways to care for those, and it's not abortion.
Yeah. Yeah.
So absolutely.
Thank you for clearing that up. So what are some of the reasons why it's important to have an ultrasound before considering an abortion?
Yes, and it ties into what we were just talking about, which is great. So with the ultrasound, just to kind of give what we kind of explained to the women who do come in, and we're discussing here, regardless if they're looking at an abortion, they're undecided or even likely to carry and do want to parent. They do come in and we give them kind of the lowdown of how the ultrasound will go. And that is making sure that we're confirming placement of the baby in the uterus, making sure that we can verify if we can see a heartbeat or not. And then, of course, assessing how far along she is or the gestational age. So that goes back to placement of the baby, ectopic pregnancy. So that's number one, because it's a huge safety issue. And I know we're going to probably get into these waters a little bit, but now that the abortion pill is it's easier to access, the safeguards are really, really just like, are almost non-existent at this point. They're really not there. So what happens is now that is becoming a more common way to have an abortion rather than surgical. I think at this point I have data here. It's back from 2022, but it was about 50% of abortions are chemical abortions.
And I think it's probably higher now. I think it's close to 60 now.
Yes. Yeah. I totally believe it, because it's so much easier to access. So what happens is, what's so important when they do come in, if they are considering an abortion, we need to verify placement, because the abortion pill, and I've actually talked to women who have had prior abortions and they've had chemical abortions and they did not have ultrasounds. And so I was like, well, I'm thankful that you are okay, because it very well could have been a much different circumstance. Because what happens is with the symptoms with an ectopic pregnancy is that there is heavy vaginal bleeding, severe cramping, abdominal pain. Well, what are the symptoms when you take the abortion pill with the mifepristone and the misoprostol? That's going to be severe cramping, vaginal bleeding with clots. So it can mask an ectopic pregnancy. So if a woman is, grabbing her abortion pills, whether it's on a website, through the mail, or getting it from Planned Parenthood or an abortion clinic, and she doesn't have an ultrasound, then what happens is that she doesn't know where she just has her last menstrual period to go off of, which is how we date and figure out gestational age through the ultrasound. So, and I'll get into that a little bit as well. But number one, like placement is huge. And if she doesn't have an ultrasound, she can't verify placement, and that puts her at a huge risk.
Because it feels like, because it feels like anecdotally anyway, that we're seeing there are a lot more ectopic pregnancies than historically there have been. It feels that way anyway.
Yes.
Like there's more.
Yeah. I want to say, and I don't I was trying to look through our stats and I couldn't find the exact number. And I know that I had talked to the other nurses about this at some point within the past 6 months. But I know last year in 2024, I want to say, oh my goodness, we had quite a number of ectopics, a couple of live ectopic pregnancies, one being 12 weeks.
Gosh.
And
wow.
she 12 weeks and 2 days. And she actually was considering an abortion. And to share a little bit about that, when she saw the ultrasound, she was still I really don't know what I'm going to do. But she saw the ultrasound and she had said, oh my gosh, I can't have an abortion. That baby has all its parts. And then unfortunately having to tell her that it's an ectopic pregnancy.
Yeah.
It's heart-wrenching. So, we had seen, gosh, I know it was, I want to say anywhere from 6 to 8 ectopic pregnancies, I want to say in 2024. But I know it's more than I think we had ever seen.
Yeah.
Whether those
increasing.
were live ectopics or there was a suspicion and they got follow-up care and it was confirmed.
Right.
So it does feel like it's on the rise.
Yeah.
It's imperative.
Well, and I just think women's health issues in general, I feel are on the rise more so,
Yes,
in general. So
difficulty conceiving,
Yes.
miscarriage. I mean, I feel like all of those things are on the rise.
irregular periods,
Yes.
all those things. And so I feel like it kind of,
Which for a whole lot of reasons, which we don't have time
right,
to
exactly. but it's all
is.
just
Yeah, I agree.
being aware of it.
Yes.
Yeah.
Absolutely. It's
And
important.
can you explain a little bit too about, you were talking about last menstrual period, and there's actually two
Yes.
ways to that are weeks are counted in a pregnancy. There's one way that's normal, and then there's another way that they can also count as far as their actual after conception. So many
yes.
weeks, but normally it's based on your last period.
Yes. No, that's true.
And but because you can conceive 2-3 weeks out, depending on how long your cycle is, right?
Yeah.
In there, and then that's how many weeks from conception. So sometimes you see these numbers and they're a little different. They're off
Yes.
from each other, but that's why. But we were talking, and I want you to go into a little bit why that is not necessarily an accurate determiner of how far along someone is, because a lot of times they're a different number of weeks than they think when they come in. When you get to see that ultrasound, that's another reason why those ultrasounds are important, right?
Absolutely. Yeah. I mean, I feel more, I think we were talking about this briefly. I think more often than not, we have women that come in that are I have irregular periods. I'm not really sure about when maybe my last menstrual period was, or maybe I thought it was around this, this date. So in the medical community, we do go by that first day of that last menstrual period, and that calculates the gestational age. But what happens, and why, it's another really important thing that we look for, is how far along a woman is in her pregnancy. Is because most of the time there are times where it is inaccurate. So they come in, they're well, my last menstrual period was this, so I'm 8 weeks along, and then lo and behold, they're maybe 11 to 12 weeks. So that brings up a whole safety issue, because the FDA has only approved the abortion pill up to 10 weeks. And actually back in, I think the year 2000, it was only up to 7 weeks.
Right.
And now we've gone from 7 to 10 weeks. And then we've actually had one gal come in and either had the abortion pills in her possession, or she was going to go get them, and she was told that it was okay to take them anywhere between 12 and 13 weeks, which is not
They keep pushing that
acceptable
envelope.
for many different reasons. Because the later you go in gestation, the longer you go in gestation, the greater the risk factor is. I mean, the abortion pill in general is those risk factors are 4 times greater than surgical. But so when she doesn't know, like, so if she didn't get an ultrasound and doesn't know when, like, exactly, the ultrasound will tell us through measurements exactly how far along a woman is, her gestational age is, and the gestational age of the baby. So what happens is if she does not get an ultrasound, she's just banking on this last menstrual period. It could be around here. Right. And that's not always accurate. And we see that time and time again. And like those consequences can be very drastic.
Right. Yeah, and especially
emotionally and physically.
Yeah. And especially like you were saying, with so many women having like so many issues, you don't necessarily know how many weeks that is. And the farther along, and it's a little difficult to get. I was looking. I've seen a bunch of different numbers, but it's hard to get an accurate number because they want to say that it's really low failure rate, but the anecdotal rate of it can be up to 20% failure rate, which means that then they need to come in and get a surgical abortion if it doesn't complete. And the farther along you are, the more likely that is to happen, the more likely that you are to have severe symptoms, and also if there are multiple, I've seen information about that if there are multiple babies too. So like if you have twins, which is another thing that you can't tell by a pregnancy test, but you can tell on an ultrasound. I've seen things like early on, 6 weeks or whatever, it doesn't make as much of a difference. But when the farther along you get, having twins makes it even more so, a higher failure rate as well.
I believe it. Yeah. And that's such a good point to bring up. Like the pregnancy test can only, and your last menstrual period can only tell you so much because, like you said, for whatever reason, these women have irregular periods and their ovulation can be off. We don't all ovulate on day 14, like it's all over the place, and our
you mean it's not tracked like my app,
right? I know, you'd think, I know, come to find out it's like that's not always accurate for every woman's body. So so it's very imperative for those 2 things of just placement of the baby and then gestational age, because just the risk factors is very, very, they're very great, as we know.
So why is it also important to test for STDs?
Yes. Yep. So we, through our ultrasound appointments, we do offer limited STD testing. So all that means is that we test for 2 very specific ones, gonorrhea and chlamydia. And why do we test for those? Mainly for those who are considering, an abortion or undecided about their pregnancies. Because most of the time, women and men won't have any symptoms. It's very common to not have symptoms with chlamydia and gonorrhea. And so they could be walking around for who knows how long with this infection. If they're unaware of that and they do have an abortion, and something that I had asked was like, well, I understand that with a surgical abortion when I started working there. It said, I understand that with a surgical abortion because you're introducing instruments, like you're opening, the cervix, but it's still the same with the abortion pill as well, because the cervix is meant to stay nice, tight, and closed to protect the baby from all sorts of different infections. And that bacteria has the chance of lying at the base of the cervix, and you're opening that up. And if they're positive and they don't know it with either gonorrhea, chlamydia, or even something else, that's going to travel potentially and cause potential damage to their reproductive organs and cause scarring and set them up potentially for pelvic inflammatory disease. It can affect the way that they carry babies in the future, if they can even have more children like after that. So we explain that to them, and some of them are like, oh my gosh, yes, I want to know, like I want to be 100% sure about that before having an abortion.
Yeah. And this is the thing that just makes me crazy about all of that. Just, trying to make it easier and easier for them to ship abortion pills through the mail without any kind of oversight at all, without any kind of an exam, and claiming that it's safer than Tylenol. Did you know that? It's safer than Tylenol. That's what they say, but which is absolutely not true. And you referenced a recent study earlier where you're talking about 1 in 25. Is that what you said? Or did you say that a minute ago?
Yes. So the complication rate, with the abortion pills, 4 times that of surgical abortion. Yep. But 1 in 5 women will suffer a complication.
Yes.
And then, like you had said, 3 to 7 out of every 100 women who choose the chemical abortion early in pregnancy, they're going to need to follow up with the surgical abortion anyway, which they try to avoid. They think the chemical abortion and taking the abortion pills, it's more personal. I get to be in the privacy of my own home.
Right.
I won't have to deal with just like all the surgical stuff. But then we're seeing here, like, they're going to have to go. And we've seen that.
Right.
We've talked to, patients that have had that happen before. They're like, it failed and I had to go get a surgical abortion anyway.
Well, and you can have some really serious symptoms for that. I mean, severe hemorrhaging that lasts for weeks. I mean, I've even seen, it lasting for weeks and really severe pain. There's actually I was just on a website that's called littlepillsthatkill.com.
I think I may have heard of that.
And it's stories. It's through, and then there were none. So it's Abby Johnson's ministry, but she has all this information about abortion pills and people's experience with them, and whether they're both from the people that work inside Planned Parenthood talking about cases that they've seen, and also people talking about their own experience with it. But the severity of the symptoms is frequently a lot stronger and worse than what they're told that it's going to be. Yeah,
they're told that and there was actually a study recently done about that too, as far as, they were told it's just going to be like, a heavy period. That's all it's going to feel like. And, for some, they're like, I didn't have a lot of pain, but then there were some that were like, no, like I felt like I was going to die. Like it was the most excruciating pain that I was vomiting. I was nauseous. I almost passed out. And I think it even went so far to say as, if they were told that was a possible side effect of having that much pain, they never would have had the chemical abortion. And no, to go back to that stat, you're right. I think I think Michelle, our prior director of medical services, I think last year the FDA had come out with the 1 in 25 women who did take the abortion pills did land in the ER. 1 in 25. Yeah. 1 in 25. And then there's even more studies. I mean, I feel like we could go on and on about all the studies. This isn't just opinion. Like, these are facts of like how harmful this is to women. And,
well, and ironically, I think that one was based on a Medicaid study that were like women who'd had, like in California, where Medicaid pays for abortion, and they were tracking how many of them ended up in the ER. So it was like the fact that they were using Medicaid to pay for those kind of bit them, because they have facts. Because in the past, they would tell women, go to the ER and say you're having a miscarriage. Don't tell them you've taken abortion pills. But when you've got this tracking with Medicaid, that it showed the reality of what was happening. Just the fact that they're telling them, recommending that they lie, is crazy to me too.
Yes.
Because how ethical is that to tell your patients to lie when they get to the ER? Like, that doesn't make any sense.
It's not ethical. It's just, it's horrible. And as we're talking about, when I first came on with Choices, you kind of in your mind, you're like, oh, baby this, baby that, we care about the babies. And of course that's important. But then as time had gone on, it's like, this is horrible for women. Yeah. And they're being, like you're saying, coached to say, hey, if you're having complications, like, and some of these women that we've talked to that have had prior chemical abortions, or we follow up with them, we're like, did you have follow-up? And a lot of the time they're like, no. Some of them, yes, but there's a lot that say, no, I haven't really had follow-up. Yeah. And what it, like, abortion, what a disservice, but obviously just not having any sort of like follow-up care after something so traumatic.
Or education really either too.
Yeah. Informed consent. Absolutely.
Informed consent.
We'll start with,
Informed
You know, one
let's
of
start
the
with
things-
that.
Yeah, and I'm going to have you explain in a minute about the fetal development too, because that's the other lie, is that it's just a blob. It's not. It's a blob of tissue. It's not a. And I talked to a lot of people online because I would post things related to that and say, if you're struggling or you need help, just private message me.
Yeah.
And I would get random people that would private message me and talk to me. And I had this one young woman who was talking about taking the pill. She was afraid to talk to her parents. I was just trying to give her information. I offered to let her talk to somebody else who had had a chemical abortion. And, she ended up taking the pills. And she messaged me back like a few days later. And she's like, I wish I had listened to you because they did not tell me that I would see a baby.
Yeah.
That and this is one of the things that they're, so you're talking about the privacy of being in your own home, but then they're in their own home alone and, potentially really painful, a lot of blood, things like that are really difficult, something to deal with on your own. If you're, especially if you're sick, vomiting, that kind of thing, right? That's not something that you want to be alone to suffer through.
Right.
But then also they're faced with that reality of this was a baby. It's not a blob of tissue. It's not just a, cells, a clump of cells, right? That they will see in a lot of cases a fully formed tiny little person.
Yes.
Because by the time they're in the end of the first trimester, they have all of their organs.
Oh, absolutely.
Right?
Yeah, just everything needs to get bigger. Their arms, their legs, their fingers, like everything. And we even have these, little baby models from, I want to say from 9 weeks, all the way up to 28 weeks. And so in even 9 weeks, like these little arms are starting to form, these legs. And and by even like 10, 11 weeks, like you look at the ultrasound and you're like, that's a baby. Like that's a baby. It's a baby at conception. It's a baby, at that time as well. So,
but it's visibly a baby by the time they're like 10, 11 weeks.
Absolutely.
You can recognize all of the little, you can see all the little parts
Distinctive
and fingers
features.
And every organ is there. And I think people don't realize how developed they are early on.
Yeah.
Like you said, it's a baby from conception. But they really visibly look human, really much earlier than I think most people realize.
Well, and then, like I said, the example of the gal who was considering abortion, she unfortunately had an ectopic pregnancy and looked at a 12-week baby and said, "Oh my gosh, that baby has all its parts. I can't have an abortion."
Yeah.
And it's like how many other women don't have, are being withheld that opportunity to actually look at that ultrasound, and that's what we love to get to point out to them as well, just saying, hey, like this is what it is. This is your baby. There's a heartbeat. This baby has arms and legs and
then to see it's not a blob of cells also, right?
Yeah.
So
Well, and the heartbeat starts, pretty soon after you realize you're, like, by the time you've missed a period almost, it's the baby's heartbeat is there at, like, 5 weeks.
Yeah,
so.
It's anywhere from, like, 21 to 23 days of life, the heart starts beating. Obviously, we just can't see it quite yet on the ultrasound because baby's still so little, but by 5 weeks, 6 days.
Which is just when you are
ultrasound.
thinking that you're pregnant, right? That's if you figure 4 weeks-ish is, a cycle, and then you missed it and realize that you're pregnant. By that point, the baby's heart is likely beating already.
A lot of women, like out in the community, don't even have an ultrasound like that early. They have to wait, 7, 8, 9 weeks.
Because it's too tiny.
So to even see that at 5 weeks, 6 days is like, a lot of people are shocked that come and they're like, you can see the heartbeat already? It's like, yes, you can. Isn't that amazing?
Isn't that amazing? It is really amazing. Yeah.
So we've been talking a lot about why the abortion pill is so dangerous and that you can even get this in the mail and there's no aftercare and things like that. What about the abortion pill reversal and what is that kind of like, how does it work for people who don't know?
Yeah, absolutely. So out in the community, I honestly don't know how many people know about this. When I do talk to some women who are considering, abortion and even the abortion pill, we always want to make sure that they have the abortion pill reversal hotline number, APR for short. And that is through the Abortion Pill Rescue Network through, I believe, Heartbeat International. So we give them that resource, and a lot of them are like, oh, that's a thing. And so for those, I don't know how familiar people are with just like the action of the abortion. We say abortion pill, but it's actually 2 sets of different drugs. So the first one that this mainly, pertains to is mifepristone, which is the first pill that a woman takes. And what that does is it blocks progesterone. So progesterone helps to sustain the baby and a pregnancy. So what happens with that is with the progesterone, while that is sustaining the life and that woman takes the mifepristone, it's cutting off that progesterone. So the baby will die. The baby will die. It won't have like the uterine lining. It won't be enough to like help with the baby. It also helps to, when you have enough progesterone, helps to prevent contractions, keeps the cervix closed. It helps just to, maintain that environment. And then mifepristone takes that away. So what's really encouraging though is say, she leaves, she's like, well, I know I'm just going to do the abortion pill. Like, I'm just going to do it. And she takes it and she's like, no, never mind. I don't want to do this. Like, I changed my mind. And that happens. So what happens is the goal is to see her as soon as possible, but it can be anywhere within 72 hours. She can call that hotline and get in touch with a pregnancy resource center that has progesterone available. Because then what you do is you're going to flood the body with progesterone. And usually it starts out with higher doses, and as time goes on, they will kind of maintain that, taking that progesterone with like through their like first, through the end of their first trimester. It just depends on what the doctor feels like it's best to help sustain that pregnancy, but it will flood the body with the progesterone and give her and that baby like the best possible chance. So within that 72-hour time frame, usually the success rate of that is, I think, like within the 60th percentile, with taking it within that parameter for the progesterone. And I know we may or may not talk about this, but I know like there's sometimes a lot of pushback on that, like, oh, the progesterone, what about like birth defects, all of those, things after taking the mifepristone and then, restoring the body with progesterone and things like that, and attempting to save the baby's life. But progesterone has been used for decades, like especially for women who may have suffered multiple miscarriages and they have low progesterone. They're being prescribed progesterone.
Right.
And these women have babies that are perfectly healthy, don't have defects. And for me to try and not butcher this, but I thought it was very interesting, was that the birth defect rate of children born after reversal is no greater than the general population, and that's anywhere from 2.7 to 3%.
So there's no greater, there's no
no
risk.
No, there's no.
And we've seen healthy babies come out of having done the reversal or the rescue and have that.
Absolutely, yes, we've had. I think this year so far, we've had 6 dispensed, like the APR protocol. Like we've had 6 clients that we have seen with like 3 successes, so far. But we've seen clients in the past, couple years that I think one of our previous nurses, Shelley, was able to see a baby that was saved by APR, which was really, really great. So it does, and it happens. It's not just, oh, that doesn't work. Well, it's like, it doesn't work all the time. It's our goal to encourage that. But when it does work, it's like, look at this beautiful baby. And
and if you think about how short that window is, right? So they take the first pill and then they're taking the second pills within like 72 hours. They're supposed to take the second.
Like 24 to 40. Yeah, anywhere from like 24 to 48 hours.
That they're supposed to take their second set of pills for the abortion pill.
Yeah.
And that women are changing their mind in that window, right? Tells me that they're not informed. They don't have informed consent, because if they're that quickly changing their mind before it even has taken effect. So they're not having symptoms, right? Because the symptoms don't come until after they've taken the second set of pills, right? So it's not okay, I regret this because I feel sick, but it's their conscience and they're deciding that they have changed their mind. That tells me that we're not doing a good enough job of informing women of the consequences of it, because they're going in. And I mean, this is a separate thing, but the statistics show that like 60-something% of women feel pressured or coerced into having an abortion by somebody, right? By the father, by their parents, by an employer, by their school, by whatever. Like there's somebody in their life that's pressuring or coercing them, which I think is also why, that's just me personally, but I think that also lends itself to them changing their mind because they weren't really sure that they wanted to do it in the first place, and then they regret it. And it's amazing that we have this resource for them.
Yeah, it's great. Yeah. It's a wonderful resource, and to be able to, give like just handing it to them and be like, I know you feel like you've kind of made your decision already, but just in case, just in case, we would hate for it to be said of us, like she went through that and then come to find out, that was a resource. Right. And like no one told me that was a thing. Yeah. So we always just want to put that in their hand. Like this is just in case.
So choicesaz.com has it here. And then abortionpillreversal.com is a place nationally that you can get connected to. And we'll put those in the show notes as well.
Yeah,
for
that's
that information.
Perfect.
Yeah.
Yes.
Yeah.
Right. So there's a lawsuit happening right now in Arizona to eliminate some laws that relate to everything that we've been talking about today. Debbie, can you explain a little bit about that? Because it's everything relating from ultrasounds to abortion pill access, all that jazz.
All of these things that we've talked about today. So it's because of Prop 139 passing, which we've talked quite a bit about on this, and you mentioned it earlier too.
Yes.
Because of that passing, there are 2 abortionists that have filed a lawsuit against the state of Arizona. Our attorney general refused to defend our state law, and so I know, right? Yeah, I agree. Her term cannot end quickly enough.
Oh, I know.
For me.
I know.
But I agree. The whole separate thing. But I mentioned her quite a bit on the show. So this lawsuit is trying to eliminate a bunch of laws that have existed in Arizona for a while. We did another episode that was talking about ones related to like Down syndrome, and we did that. But the other side of it has to do with informed consent. So they're we have informed consent. I personally sat down at the Capitol and watched these things transpire, right? I mean, I wasn't involved in like the internal side of it, but I was sitting in the hearings watching all this. For years, we tried to get it passed and we couldn't get it passed. And then we finally did get it passed because they don't want informed consent, which is unbelievable that they don't want informed consent, but they don't. And so all of these things of like a 24-hour waiting period where, we're talking about women changing their mind or coming in and not being sure what they're doing, right? Not really, because they're scared. They don't really know what support they have. They don't know what their options are. So giving them that time to kind of think through it so that they're not making an emotional decision that they'll regret
out
later.
Out of fear, yes. Take a deep breath, take your time.
And then eliminating the need for an ultrasound, which we've talked extensively today about how dangerous that is to not have an ultrasound. And then also opening up access, because right now in Arizona, it's illegal to do telemedicine abortion, even though it happens, because it's hard to prevent it from happening. But it's illegal to do in Arizona because of our informed consent laws. So they have to be told information, told about all of these things. It's funny because I was reading through the lawsuit and actually Choices is mentioned in there. The website is linked about how, I forget what it was. It was kind of, just it made me laugh. It was funny. It was something ridiculous about how it's like.
Usually is.
Yeah, I'll pull it up. It was funny.
Oh my gosh.
I just thought it was funny. So
what was it? I'm so curious.
The pamphlet then refers patients to this is talking about the informed consent. Resource directory of pregnancy resource centers that features crisis pregnancy centers that have a clear mission to discourage pregnant people, not women, from exercising their protected right to abortion. Websites are replete with inaccurate, stigmatizing, and inflammatory statements.
I feel like
Saying
that's an
that-
inflammatory.
Also talking about how babies have tiny fingers and fingerprints and, heartbeats and all of that. That's inflammatory.
Super
and
inflammatory.
stigmatizing,
How
right?
dare we?
I know, right?
Oh my goodness.
Anyway,
I'm not,
so
I'm not surprised.
and then it
My
also
goodness.
it says multiple CPC websites, crisis pregnancy center websites advertise so-called abortion, in quotes, abortion reversal, an experimental and potentially dangerous medical treatment that has been widely disproven.
They say it's dangerous?
They say it's dangerous. This is in the language of this lawsuit, which is like, okay, that's
Now,
dangerous, but the black box warning that's on mifepristone is not dangerous, and let's just ship that to whoever in the mail, right?
It's extremely frustrating. Like
Yeah.
in man, like there's not enough vocabulary. Like you had said the touting of the comment of like, oh, this is safer than Tylenol. It's no
Right.
big deal. And there is an essay through the Charlotte Lozier Institute,
Which is fantastic.
on it, and how like that is. It's not an accurate statement. It's not truthful. Where are the studies on this? They're just making, they're just making opinions and comments, but have no data or anything to back any of that up at all. So that's very interesting that they say it's so dangerous when we had just talked about how like progesterone has been used for decades and with very positive outcomes. So.
Well, and our bodies naturally make progesterone,
Yes.
right? So our bodies naturally make progesterone. So this is not introducing some foreign thing like the abortion drugs are foreign.
Yes.
And honestly, that first drug has a black box warning label, which is the highest warning that the FDA can put out. But let's just ship it through the mail to random people and not
Let's
have
keep
any
reducing
kind of
the safeguards.
right. It makes no. I mean, it's awful.
It is.
It's hard to come up with a word that is strong enough because it's just it's criminal. I mean,
It
really,
is. It's true. It's very evil.
It's evil.
It
It
is.
really is. I mean, it sounds dramatic, but it's really not because, I mean, again, we talked about all of those different things about ectopic pregnancy and the gestational age and all of those different things that make it more dangerous.
Yes.
And they're saying that the abortion pill reversal is dangerous, which worst case scenario, it doesn't work and then the abortion is successful and completed. That's the worst case scenario. Best case, that baby is saved, right? So how is that? It's dangerous to their profit margin, but it's not dangerous to women or to the babies.
Yes.
Right?
Well, they didn't specify that, right?
So, oh my gosh, I have strong feelings about those things.
Is there anything people can do about the lawsuit, or
So not really at
that's a
this
great
point because it's
question.
kind of out of our hands at this
Okay.
point, other than be sharing this information because I do think it's important because again, when we talked about when Prop 139 was going on, it's like people thought that miscarriage care was going to be made illegal and ectopic pregnancy care was going to be made illegal when really, honestly, it's places like Choices that are looking out for women when they're having those things more so than the abortion clinics are and looking out for women's health completely. And also too, right, so if offering diapers and parenting classes and all kinds of other things. And if a woman does decide to have an abortion, she can still come back to Choices and get help after the fact as well.
And we encourage, and we, would we love for them to parent their child, for them to, and if it's better for them to place their child like for adoption, be as involved or not involved, like we would love that, not only for the baby's sake, but for her sake.
Right.
But we know that's not always the case. And that's something we as nurses have to let go of and let the Lord do his work. And if she does decide to have an abortion, but to let them know, I think we as nurses try to let them know, like, no matter what you decide, you are always welcome here. And we do have post-abortive care groups so you can be cared for. We're not going to shut our doors on you.
Right.
So because they need so much care afterwards. It's so awful.
And then on the other side, on the opposite extreme, right, if they go into an abortion clinic, if they decide to parent, they don't get any of those things. They don't get any diapers. They don't get any parenting classes. They don't offer help for anything other than giving them and selling them an abortion.
Yeah.
So it is a very stark difference. And I think that people need to make sure that they're informed about what's going on. That's really the biggest thing. We do want to make sure that if you haven't already, to thank Steve Montenegro and Warren Peterson, who are the Speaker of the House and the President of the Senate in Arizona, because they stepped in to take on this case because our Attorney General refused to uphold state law. And so these are not things that impede a woman's ability to, like, it should not go against the Prop 139. These are safeguards and things that protect women's health. If they're all about women's health, then why are they so desperately trying to put women's health at risk?
No, that's always my question when I look at that. Is like, if you really want to empower women or to care for them, what the actions so far are not reflective of that at all.
Yeah.
At all.
And then we'll put some information in the show notes and have that. But thank you so much for coming and sharing your expertise.
Yes.
This was fantastic. We appreciate you being here.
Yes, happy to help. So thanks for having me.
And thank you for joining us on Into the Fire, powered by Dream City Church.
You can listen to this podcast on Apple and Spotify and follow us on social media to find all the info on the show notes. To learn more about Dream City Church, visit our website at dreamcitychurch.us. Thanks for listening.